Stand by. This is a 1-minute warning. Stand by.
Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joining you today to provide an update on the public health aspects of the COVID-19 situation across the state. We begin today's briefing for today, Wednesday, May 13th, on a sad and somber note. Maine CDC is reporting the passing of a woman in her 90s from Cumberland County with COVID-19. Her passing marks the 66th death related to COVID-19 across the state. And she leaves behind, as all who have passed, family, friends, and a community. And we at Maine CDC offer those family members, friends, and community our deepest condolences during this time of grief. Overall, Maine CDC is reporting 1,515 cases of COVID-19 across the state, an increase of 38 cases since yesterday. Of those cases, 1,372 are laboratory confirmed and 143 are probable. 204 individuals have been hospitalized, which is an increase of 2 cases since yesterday. And currently, 41 individuals are in the hospital, 20 of whom are in the intensive care unit, and 7 of whom remain on ventilators. Overall, 943 individuals have recovered, which is an increase of 30 since yesterday. And of our 1,515 cases, 333 are among healthcare workers. Overall, since we've begun our COVID-19 activation, Maine CDC epidemiologists have fielded now 6,727 consultations from healthcare providers across the state. I'd like to provide an update on the cumulative number of tests that have been done. I'd like to talk first about the number of individuals who have been tested. This is the number that Maine CDC has typically reported on a weekly basis on our website. And thus far in the state of Maine, 28,257 individuals have been tested. However, I'd like today to report some new information. At the recommendation of the United States CDC, the state of Maine will be soon, in fact today, shifting our reporting from the number of individuals who have been tested to the number of tests that have been performed. That's actually a number that's more consistent with what other states have been reporting. And so overall, looking now not at the number of individuals who have been tested, but the cumulative number of tests that have been performed, that number stands at 33,035. Again, that's the number of tests that have been performed across the state. That number is 33,035. Very soon, Maine CDC will be adjusting our website to reflect this number, the cumulative number of tests that have been performed. For today, I wanted to share both numbers with you and provide a glimpse as to why we're changing. The bottom line is that as we see more and more outbreaks occurring and more people being tested serially during those outbreaks, we'll then, as other states are, start shifting our reporting to the cumulative number of tests that have been performed rather than the number of individuals who have been tested. I'd like to turn now to an update on where we stand with respect to our public health emergency preparedness activities. First is an update on our fit testing work that we've been undertaking in partnership with the National Guard. Yesterday, our colleagues at the National Guard fit tested 81 healthcare workers across the state. And today alone, we'll be fit testing an additional 112 healthcare workers across the state. Cumulatively, since the National Guard undertook this large statewide effort, they have fit tested 546 individuals and still have a remaining 565 folks who are waiting to be fit tested in the coming days. Again, fit testing is a necessary prerequisite for a healthcare worker to undergo before they can utilize an N95 mask. And again, the Guard has now fit tested 546 individuals with another 565 to go. It's been tremendous effort on their part, and I'd again like to take a moment to thank the women and men of the National Guard for their joint effort with Maine CDC on getting as many fit tested healthcare workers as we can. As I mentioned yesterday during yesterday's briefing, Maine CDC received and delivered 10 cases of remdesivir to hospitals across the state. We learned yesterday evening that all states may soon be receiving additional supplies of remdesivir from the federal government. Although we weren't provided a timetable as to when, we have been informed that additional stocks may be forthcoming as soon as next week. If and when we get confirmation of additional supplies being forthcoming, we'll make sure we let everyone know. Overall, Maine CDC today will have crossed the threshold of having completed and fulfilled over 1,600 orders for PPE across the state. The bulk of those orders are going to congregate care settings as well as to locally based fire, EMS, and rescue agencies across the state. We will continue those efforts to make sure that frontline healthcare providers have the necessary supplies that they need in order to stay safe on the job. A brief update on the vital assets that Maine CDC has been tracking. Overall, there remain 361 total ICU beds across the state, 159 of which are available. There are 313 conventional ventilators across the state, of which 226 are available. And there remain now 416 alternative ventilators that are available across the state. I'd like to end on a note that echoes some concerns that we've heard and something I'd like to share with everybody about the importance of routine medical care during this time. It's frustrating being inside, especially as long as many folks have been inside right now. Probably the number one question that I get is, what can I do? What can I do to help? Today, I'd like to offer everyone who's watching something concrete that you can do to help keep yourself, your family, and your community as safe as possible. And that is keeping up to date with your routine medical visits with your healthcare provider, especially well child checks and routine vaccinations. As we talk about resuming contact with another, as we talk about reopening, and as we talk about returning to the recurring rhythms of daily life, through those playground visits and play dates and family barbecues, I ask everyone to make sure that they and their family members are up to date on routine recommended vaccines. That's one of the best ways to make sure you're protecting not just your family members, but other folks in your community who may be elderly, who may have chronic health care conditions, or who may be immunocompromised. as we talk about reopening, we want everyone to be in optimum health for when we start resuming that contact. Although there may not be yet a vaccine for COVID-19, there are vaccines for other preventable diseases. And we ask everyone to make sure that they and their family members are up to date. There are vaccines for diseases that can be prevented today, and you can access those vaccines through simple, routine medical visits with your healthcare providers. I emphasize this all because preliminary data from the US CDC, nationwide data, have shown sharp decreases in the numbers of vaccines that have been ordered and administered to children across the United States. Here in Maine, looking at our own data from the Vaccines for Children program, which is administered by the Maine CDC, we've seen some concerning signs on the horizon. Just in the month of March, distribution of vaccines to children who are enrolled in the Vaccines for Children program dropped 28% compared to March of last year. In April, we saw continued signs on the horizon. The data that we just tabulated shows that distribution of vaccines in the state of Maine to children enrolled in the VFC program dropped 45% just in the month of April compared to April of 2019. So why is this happening? Well, we've talked to a lot of folks, and here's what we've heard. Some parents may be reluctant to take their child in for a well child checkup. They might be concerned about bringing their child in to a doctor's office and potentially exposing their child to any number of diseases, including COVID-19. But what I'd like to remind everybody about is that the healthcare providers who care for kids dedicate their professional lives to ensuring the safety of children. And they are now finding new ways to ensuring the safety of the children that they see, your children, even during these challenging COVID-19 times. Providers in Maine are doubling and tripling the amount of cleaning that they're doing, sanitizing surfaces, making sure that the office is as safe as possible. Providers in Maine are doing things like offering curbside vaccinations. So you may not even have to take your child into the office. The vaccine will come to you rather than you having to go into the office to get it. Some providers in Maine are doing well child visits and vaccination schedules on the weekends. Other providers we've heard from are doing, for example, well child checkups and vaccinations in the morning and reserving the afternoon for children who might not be feeling well. All of that is to say, healthcare providers in Maine remain dedicated to making sure that you, your children, and your family have access to routine medical care, especially vaccinations, even during these difficult times. Maine CDC is part of those conversations. Actually, today, we're sending out a communication to providers to help providers help get kids back into the office for this exact type of routine health care. We're also continuing to work with practice groups across the state to provide them with the tools they need to keep kids coming in for their routine health checkups. As Maine reopens, there may be children who need to catch up on immunizations, and that will invariably increase the wait time for appointments. While those children are waiting for those appointments, they could potentially be exposed to dangerous and preventable illnesses that might be circulating in our community, separate and apart from COVID-19. I urge everyone to take steps to avoid that danger by making sure your kids are on track with their vaccinations. Now, I want to be candid with everybody. We recognize that this is not as easy as it used to be before COVID-19. The Maine CDC is working with providers across the state to make this process as routine as possible at a time when nothing has been routine. So I'd like to turn now to our colleagues in the media to take their questions. And today's first question goes to Lindsay Mills over at News Center. Go ahead, Lindsay.
Hi, Dr. Shaw. Off the top, you mentioned that you would be saying the number of tests done versus the number of people tested. How is this new number helpful for us, and how many individuals are getting more than one test on average? Do we know that?
Sure. So Lindsay asks about what the new type of reporting of tests reveals. And Lindsay, what we're seeing now in Maine as well as in a number of states is that a large number of the cases that we're seeing are associated with outbreaks, particularly outbreaks in congregate settings. And those facilities are moving to retest individuals on a serial basis. Some are doing, and the schedules vary, and they vary based on different circumstances. But given that a high number of cases are now occurring within these congregate settings, we know that there will be some degree of retesting. How often that's occurring will really depend. In fact, the US CDC is itself evaluating their own testing guidelines to try to provide better guidance to states on how often retesting or serial testing should occur. So we don't yet have a good estimate of what that will look like. But what this will help us do is really characterize what is fundamentally the most important piece here, which is, again, not so much how many individuals are being tested, but how much access any individual has for a COVID-19 test. It's a better marker of the overall testing capacity rather than the individual numbers of people that are getting tested. That's why we, at the recommendation, at the behest of US CDC, are moving in that direction. I'm going to turn now to Brian Sullivan over at WABI.
Yeah, Dr. Shaw, I have two questions for you. First off, Cedar Ridge and Skowhegan, one confirmed case there, but a spokesperson said that everyone there today was going to be tested. I think they have around 90 people in total. Is that a direct result of the increased testing capacity?
So Brian asks about Cedar Ridge and Skowhegan. And Brian, you're correct. We have been informed that there is a single case associated with Cedar Ridge and Skowhegan. It does not yet rise to the level of an outbreak, which, as we talked about yesterday, requires at least 3 cases and an epidemiological link. However, the management of Cedar Ridge felt strongly that they wanted to move toward universal testing. We certainly did not disagree with that. Maine CDC's laboratory here in Augusta will be running those samples. We are doing so now. And so, Brian, I guess in direct answer to your question, it's not a direct result of the expanded testing capacity, but it is in line with the recommendations. It was something that they themselves offered and that we agreed with.
Okay.
Yep.
And my next question is in terms of the way that we're releasing the information on case counts. I know you've talked about it in the past, but is there any thought being given to going town by town, or perhaps in the communities or the counties where there has been community transmission, more specific information, particularly in a large county like Penobscot?
Brian asks about whether we've reconsidered moving to a town-by-town release of data. And Brian, we've continued to discuss that. And again, our analysis around community transmission, what we found is that where there is community transmission in a county, it is occurring across the county. And so there's not really a differential risk for anyone in any county where community transmission has been detected. And so for that reason, we're going to continue to stay with the county-by-county release of data. I'd like to turn things over to Steve Missler at Maine Public.
Thank you, Dr. Shaw. Just a quick question, and then I have a second one. Is there anything about the 38 new cases that is notable? Are they in a particular area, or is there another outbreak or anything like that? And yeah, that seems like a significant jump, at least from yesterday.
You're right. So, Steve, there are no new outbreaks, and the only new additional the only case at a new facility is at Cedar Ridge and Skowhegan, which again does not yet rise to the level of an outbreak. But we were talking about that exact question this morning, Steve, and a lot of what we're seeing now are close contacts of confirmed cases, and that's again consistent with the U.S. CDC's guidelines. So what we're seeing a lot are household degrees of transmission rather than a large amount of community level transmission, but nothing new on the facility level outbreak front.
I mean, does that suggest that, I don't know, that people are being a little more lax in their distancing? What could we read into that? Out of curiosity.
Yeah, I hear where you're coming from, Steve. I don't think we glean that. Here's what I mean. Although I don't have the exact numbers with me, there doesn't seem to have been an appreciable increase in the degree of household transmission that we've seen. It's been largely the same, not just in Maine, but honestly across the country since the numbers began reporting. As you can imagine, it's very difficult, even within a large household, it's very difficult to isolate in such a fashion as not to possibly infect other people. The other thing I will note, Steve, is that although this is an increase since yesterday, it does put us back on the 20 to 30, 30 to 40 new cases that we saw previously, suggesting that the R0 has been staying at around 1. That's a lot of words to say that as a percentage of new cases on a daily basis, even though we're seeing about the same number, as a percent of the total of new cases, as a percent of the total cases, the number of new cases is a shrinking percentage every day. We're getting more cases, but the same number approximately. I think I mangled that sufficiently. But the point is we haven't seen an appreciable uptick that suggests that there's more laxity in the way that people are going about their isolation.
Gotcha. Okay. And then to the question I had going into today was that, as you know, the governor's under a lot of pressure from businesses in the hospitality industry to scuttle this 14-day quarantine requirement for visitors, out-of-state visitors specifically. But unless something has changed since yesterday, I think Maine would be the first and only state in New England to do so. Now, that's not to suggest that you're doing that, but can you outline the risks associated with getting rid of the 14-day requirement, especially if other states retain theirs? And again, I know business owners are pushing this because they're making the case that they can operate safely, but in your mind, what would be needed on their part to achieve the appropriate level of safety?
Yep. So Steve asks about reopening, particularly as it relates to what's currently in effect as a 14-day quarantine. Steve, this is something that we've been discussing quite a lot. The analysis is challenging for a number of reasons, just from a public health perspective. One of the complicating factors is that as an overall prevalence matter, on a per population basis, Maine has significantly lower numbers of cases. I haven't checked Massachusetts, but the last time I did, they had 70 times the number of cases, as did the state of Maine. That number may have changed. Even our immediate neighboring state has a significantly higher fraction of cases. So that complicates the analysis when you think about the folks who may be coming here to visit. Now, in terms of the specifics, Steve, I'm going to refer you over to DECD. They've really been the ones thinking about and leading the efforts around reopening more generally, specifically as it relates to tourism. And so we'll refer your question over there. They'll have a bit more insight into where that discussion stands, Steve. I'm going to turn now to Kara DeRose at the Maine Beacon.
Thank you. So we heard from federal public health officials yesterday that they're still concerned about a potential second wave of cases as states begin to reopen. I was wondering if there are any specific preparations Maine is making in case there is a second wave. And do we have any modeling that makes any predictions about whether one is likely to occur in the near future?
Sure. So Kara asks about the possibility of there being a second wave of cases. Something that was discussed yesterday in Washington, D.C., as folks probably heard about, and that is a concern. I'll say again that although we remain concerned about a second wave of cases, we're just as focused on the current wave of cases that we're contending with. But Kara, to your specific concern, that's one reason we take a look at all the data on a daily basis. It's one reason we want to make sure we update our website. It's one reason I chat with everybody every single day, so everyone has a sense of where we stand. The preparations around a potential second wave of cases in many ways replicate the preparations we made for the first wave of cases, making sure that we're keeping tabs on the data, making sure we know what the vital medical assets are, whether that be ICU beds or ventilators, and making sure we continue to keep an open line of communication with healthcare providers. What's challenging in this situation, though, is that any potential second wave, if it were to arrive, the dynamics of what that would look like could be varied. Kara, you asked about modeling, and the bottom line there is that there are models that speculate different types of scenarios around a second wave if one were to occur. Some of the models suggest that continued physical distancing could potentially preclude a second wave. Other models suggest that even with aggressive social distancing, if we lift it too early, there might be that second wave. We don't know yet as to what the magnitude of that wave might be, whether it would be higher than the current wave, or whether there might be smaller subsequent waves. The other big question is when that second wave might occur, if it were to occur. I want to stress, we can't predict whether that might happen. But based on the seasonal impact of the virus, a potential second wave that coincided with flu season in the winter could be especially challenging for every single person in Maine. The flu is bad enough. When you add on top of that flu plus COVID-19, you really look at a significant health threat, potentially the possibility of individuals being co-infected with both at the same time. Each disease on its own is a challenge, but the intersection of having to contend with both influenza as well as COVID-19 would test even the healthiest people's immune systems, to say nothing of the impact on the healthcare system. So thank you for that question, Kara. Certainly something that is top of mind for us. I'd like to turn next over to Caitlin Andrews at the BDN.
Thank you, Dr. Shaw. I have two questions. One is I would like to follow up on the group home outbreaks that were announced earlier this week and see if there's any more information about those. But I also wanted to ask, do you have guidance specifically for providers about when these outbreaks occur in these group homes, which are typically smaller than congregate care settings? Any different things they should be doing to try to treat those rather than what we're seeing, say, at a long-term care facility?
Sure. So Caitlin's first question, her questions relate to outbreaks that we've seen at group homes. Caitlin, there are no new numbers related to those outbreaks right now. We do get test results as the day goes through, as the day goes on. As of this morning, there were no new updates. If that has changed since 8 a.m. this morning, we will let you know. But again, as of early this morning, the numbers at the group homes that I've noted have not changed, but we'll double check to see if something has changed in the intervening 7 hours. Now, as it relates to specific guidance for those homes, in some sense, they are similar to other congregate settings, right? They have individuals who are coming in and folks who might be medically vulnerable. But given that they are often smaller in size and often have the same individuals coming in every day rather than different individuals, the dynamics of any outbreak are somewhat different. So on one hand, the fact that the homes are smaller means that the likelihood of transmission of other folks getting ill within the home is higher. So that's a concern. That's one reason we have continued to push out PPE to those group homes, not just nursing homes and assisted living facilities, but to the group homes themselves to try to reduce the likelihood that other individuals in the home might get ill. Again, some of these homes maybe have 3 or 4 residents in them and 1 employee. It's difficult, even in a large house with 1 or 2 people, to maintain that social distancing, as we were talking about with Steve. But in a smaller home with more people, it's equally challenging. The other piece of guidance that we do recommend in these situations is for the healthcare providers who are working in those homes, for them themselves to stay as safe as possible when they're not at the home itself. It's impossible to track exactly how an infection may be brought into the home, but to the extent that we know it comes from the outside, we really want those healthcare workers to try to stay as safe as possible when they're not at the home. That's why we, again, push out PPE to them to make sure they're able to stay safe and reduce the likelihood of an introduction into the homes. Again, we'll check on the latest numbers for you, Caitlin. If anything has changed, you'll have those. But as of this morning, there had been no new updates.
Thank you. And then I just want to follow up on the vaccination numbers that you mentioned. Those refer to the Vaccine for Children program, correct?
That is correct. Those numbers are only for the VFC program. It will not be until July or so, mid-July perhaps, that we've taken a statewide census for the second quarter of the year so that we will know exactly what the overall numbers of immunizations are. The numbers that I reported are just for vaccines distributed to VFC providers across the state, and there are about 350 such providers across the state.
Okay, because I wondered if you had any sense of what those vaccinations are looking like, if those are kind of following that similar trend or if they're kind of staying the course.
We won't really know until probably July as to what the numbers from Q2 look like. For Q1, January through March, the numbers of vaccinations were largely the same as they had been 1 year ago prior. There was no appreciable change year on year or quarter on quarter. But obviously, things really started to change nationwide starting in April. That's when the US CDC started noticing a decline in the number of orders, as well as we starting to see it in our state numbers. That data from the US CDC, by the way, is published online. You can find it in the US CDC's own journal called the MMWR. And when we saw those numbers, we were already tracking what we were seeing in terms of Maine's numbers. And there's a high degree of concordance between what was happening in Maine and what was happening at the national level.
Thank you.
You bet. I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shaw. Could you give an update on Preble Street, and also are the cases, still no new cases at Hope House in Bangor? Or Oxford Street, not Preble Street, excuse me.
Yep. So Amy asks for an update on our continuing work in shelters for people who are experiencing homelessness. And Amy, the bottom line there is, as of early this morning, there were no new cases in either such facility. As with Caitlin, if that's changed since 8 a.m. this morning, we will let you know, but there have been no new cases as of this morning in either of the facilities for people experiencing homelessness.
Great, thank you. And also, are you still seeing cell phone data and DOT tracking data? Could you tell us what that's showing since Monday with the restrictions being loosened a bit?
I have not seen the latest update on the cell phone tracking. I want to just once again underscore these are publicly available data that the cell phone companies themselves collect and put on public websites. Maine CDC, Maine DHHS, nor the state of Maine, no one at the state level is tracking or accessing unique or private cell phone data. These are public data that are on public websites. I have not yet taken a look at it since Monday, Amy, to see what the latest trends show. We can certainly do so, but I should note they are also publicly available for all to see.
And the DOT?
The DOT data, I have not seen an update on that this week either. That is, again, that's vehicle tracking data and data from the Maine Turnpike. Again, haven't seen those data since about a week ago, when the numbers had largely been the same, but I haven't seen them yet this week. Again, we can certainly check on that, and we can absolutely refer you over to DOT for the latest data there. I'm going to turn now to Steve Betts over at the Courier-Gazette.
Thank you, Dr. Shaw. What guidance would you offer to city officials, town officials, county officials who are considering reopening town offices and city offices to the public? And what steps should they take to make it safe if that should be done?
So Steve asks about guidance for city officials, town officials who may be thinking about reopening town offices. And honestly, Steve, what I'm going to talk about really applies to any potential facility where workers may be coming in contact with the public. There are various controls, and this is all assuming that a city wishes to go in that direction, and each municipality has to do what is best for them. However, provided they do decide to go down that route, there are various engineering controls, as they are called, that can be put into place that reduce the risk of any kind of disease transmission, not just COVID-19, but a number of other respiratory diseases. And these controls include things like plexiglass shields that can reduce the amount of respiratory droplets. They can include making sure that workers have access to PPE. They can include asking anyone who visits to try to put on a face covering. All of these things can reduce the risk of COVID-19. But the operative word there is reduce. It's very difficult in any such setting to get that risk to zero. So that's why it's important for each and every town to take steps to do everything they can, not just to protect people, but also figure out what level is best for them. It's a challenging situation, but there are steps that are out there that include changing our physical environment, the way that we all interact with those essential workers, whether it's folks at the town office when you go to renew your auto registration, or when you go to that 7-Eleven to buy your Ben & Jerry's. There are things that folks can do who operate and manage those facilities that reduce the risk to all of us.
Thank you.
You bet. Going to turn next to Megan over at WMTW.
Thank you, Dr. Shaw. Thank you for taking my question. I wanted to follow up to reports that there was a construction worker who tested positive for COVID-19 at the Maine Veterans Home construction site in Augusta. I didn't know if there was any more information on that investigation from an epidemiological standpoint. And also, does this sort of underscore the concern that many Maine workers have that out-of-state contractors are bringing people in and making these kinds of workplaces unsafe?
So Megan asks about the potential for a construction site to be a spot for an outbreak. And Megan, what I can tell you is that we're not aware or have not yet detected an outbreak at any type of construction site across the state. As reports come in and as we investigate and make contact with the close contacts of any confirmed case, we may discover that there has been an outbreak or there is an outbreak ongoing. But as of right now, we have not yet detected or confirmed that. You asked more generally about workers and the possibility for there to be outbreaks at workplaces. And outbreaks of that sort are a risk. It's sort of similar to what Steve Betts and I were just talking about. Outbreaks in workplaces remain a risk. There are various controls that can be put into place that reduce the risk, whether it's those plexiglass shields that we've become accustomed to now, or whether it's folks wearing face masks. There are things that can be put into place. Some work sites are higher risk, such as healthcare facilities. Others are lower risk. Outdoor facilities, like construction sites, the risk of outdoor activities and outdoor facilities, outdoor workplaces, has not yet been fully characterized. There's a little bit of data out there to suggest that outdoor activities may be a little bit less risky than indoor ones. But right now, the data are not all yet in. And we don't know why that might be, even if it were to be true. It could be that outside, people are just naturally more spaced out. There's a lot of scientific investigation going on right now to try to help us get a better sense of how any outdoor activity, be it a workplace or just being outside, how that changes the risk profile. Right now, the science is still being done. Hopefully, we'll have a better sense very soon. I'm going to turn now to Joe Lawler over at the Press Herald.
Yes, hi. My question is around testing. It looks like when you look at the total number of tests, negative tests, week over week, it looks like close to double the number of tests were performed compared to previous weeks. Is that a reflection yet of the partnership with IDEX, or is there some other explanation? And I noticed you mentioned that the percent positive rate is going down. If you could share that with us. And then my other question is just simply, I know you mentioned that there's no new outbreaks. There's a lot of close contacts. Are any of the close contact or a significant portion of the close contacts related to previous outbreaks, such as relatives, friends of Tyson Foods, for instance, or is there any connection?
Got it. So Joe asks first about testing numbers. Joe, I'm not. You know what? Maybe I'll put you in touch with Robert. We can potentially go through the numbers. I don't know that I'm with you on the arithmetic, on the math. So we can go through those in a little bit detail. Testing has gone up, but I don't know that, again, I think safest thing to do is to go through the numbers in a little bit detail so we're giving it to you straight and accurately. As of right now, and as we've talked about last week, our lab in Augusta is still ramping up and getting all the scientific steps it needs to accomplish in place before we fully start utilizing the IDEX equipment. We're on track to do that probably by Monday, if not a little bit sooner. So the increase in testing that we've seen in the past week, both in terms of the number of people and now this metric that we're really going to start tracking, the total number of tests, is related to a number of things. One, of course, is that Maine CDC has been out there recommending universal testing in a number of situations, be that Tyson, be that Springbrook, more recently at the facility in Skowhegan. So there's just more testing that's being recommended. It's also the case that some of the national laboratories have been able to conduct more and more tests. We had a conversation with one of those laboratories not too long ago and asked them, what's the most number of tests that we could send to you? And they said, we've got a lot of capacity at our various national labs across the country. So much so that when we said, well, what about 1,000 a day? They didn't even blink an eye. This is on top of what Maine CDC's laboratory is expecting to do, which is also about 1,000 per day. So we're really ramping up the overall capacity. Now it's just a matter of filling that. As we move toward more and more testing in congregate care settings, we'll hopefully see these numbers continue to go up. Joe, you asked about the positivity rate as well. I've got to make sure I calculate this and triple check my math. But based on the number of tests, not the number of people, but based on the number of tests, our positivity rate seems to be about the same, which is under 6%. I'm going to, again, triple check the math. We literally just got these numbers 25 minutes before I walked in. So I think our positivity rate is about where it has been. For reference for everybody, according to the World Health Organization, any type of jurisdiction needs to have a positivity level at a minimum of below 10%. That, according to the World Health Organization, is the bare minimum for what a positivity level should be, which is below 10%. And Maine's has hovered between 5 to 6%. We're hoping to bring that even lower. Our goal is to try to replicate what South Korea achieved, which is a positivity rate of around 2 or 3%. But even when we have been at our highest, we are still significantly under what the World Health Organization recommends. As it turns out, I was just not too long ago on a call with a very senior member of the US CDC, and he himself endorsed that 10% threshold as well. So I'm proud to report that Maine has been well below that. For reference, other states and cities where they've been also doing a lot of testing have had positivity rates in the 15 to 20% range. Joe, you also asked about the new cases that we've observed and whether any of them are related to ongoing outbreaks. Thus far, we haven't detected that. But as you can imagine, Joe, it does take at least a day between when a case is reported and when our contact tracers make contact with that case to try to determine whether there's any epidemiological link with any ongoing outbreak. As of right now, we haven't detected that. I'm sorry, Joe. No, I take that back. Of the 5 cases in the past 24 hours, 5 of them, of the 38 cases in the past 24 hours, 5 of them are linked to ongoing outbreaks. And as we conduct more and more contact tracing, that number may increase. But as of right now, Joe, to your question, of the 38 cases in the past 24 hours, 5 of them are linked to ongoing outbreaks. The last question for today goes to Brad Rogers over at WGME.
Okay, thanks, Dr. Shaw. First, do you know how many negative tests there have been of the 33,035? How many of those are negative?
Yes. Just doing the math. Hold on. Sorry, just doing the math real quick. Give me 4 seconds. Okay, I want to. It is 30,985. However, Brad, I want to make sure that that number includes negative antibody tests. So it is at least 30,985 if I'm able to subtract correctly.
Okay.
But it might be higher. I want to make sure that that includes the antibody tests. So it's at least 30,985, and it might be a couple hundred higher.
Okay. And then I'll just ask one more question. You talked about it being important to take your children in to get checked up and get vaccines. There's a lot of people have elderly parents, and I think they're very concerned about taking their elderly parent to the doctor with healthcare workers, testing positive for this. So what would you say about that?
Brad asks about taking our elderly parents to the doctor. And let me just tell you, Brad, this is something that I have very recently had personal experience with. And this evening, it's something I'm going to have personal experience with again. In the past 3 weeks, as my family and I have visited healthcare providers across the state, we have been, me personally, I have been completely blown away and impressed by the steps that healthcare providers in clinics and hospitals across the state, by the steps that they have taken to prevent the transmission of any type of disease, including COVID-19. This is what healthcare providers do. They dedicate their professional lives to keeping people safe and healthy. And for a healthcare provider, one of the things that keeps us up at night is the possibility that someone could come to an office to seek healthcare and themselves get sick as a result of that. It's up there on the nightmare scenarios that I know keep each and every healthcare provider in Maine awake at night. And what I've seen on a personal note is that the healthcare providers that we visited have gone to extraordinary lengths to make sure that there are these engineering controls in place, to make sure that every healthcare provider is wearing a mask, to make sure that every patient at a facility is given a mask, to make sure that hands are sanitized, that contact is reduced. It's so much so that one facility that we visited has actually stopped the process of using pens and things like that. They're documenting things verbally rather than even taking the small risk that something like a pen could possibly transmit disease. So Brad, what I would offer to anyone who's out there visiting, whether you're a parent of a child or the son or daughter of an elderly parent, healthcare providers in Maine are standing, willing, ready, and able to take care of you, whether it's getting your child vaccinated or getting your parents vaccinated for things like pneumonia. This is what they do day in and day out. And they've taken extraordinary steps in these challenging times to continue doing that. So although I know that right now is nothing but routine, everything is harder right now, and these times are dizzying because of how much has changed, I still urge everyone to make sure that those routine healthcare visits are something that you still undertake. Doctors in Maine, based on, again, our own experience, are able to do these visits through really innovative ways, whether it's through Skype and FaceTime and Zoom, or sending home health nurses to your home in order to get blood draws. Healthcare should not have to stop right now, even though so many other things have had to be put on pause. So with that, everyone, thank you all for joining this afternoon. As always, please take care of one another and be kind. I look forward to chatting with everyone tomorrow. Take care. We'll talk soon.